Welcome back to OrthoDx tutorials. In this tutorial, we're going to show you how the surgical treatment objectives work. As you have done already your tracing, on the right side, right corner menu, you can select STO and it will take you the surgical treatment objective function. On the main menu, you will notice that all the lines and landmarks have disappeared, just the certain jaws and the teeth appear. On the left side, you can always change your analysis you're dealing with. And then you will notice on the lower right section, lower right panel, you will see the measurements, current measurements, and on the upper right panel, you will see your surgical planning measurements appearing. Now let's talk about how to change each position of the jaw. Each landmark or each blue dot represents certain features of the jaws. If you move your cursor to one of the blue dots, the names of each segment will appear representing that blue dot. If you want to move the jaw, you come to the blue dot, click and drag your mouse. So at the same time, simultaneously when you're moving your jaw, you will notice that on the right section, the curves of the soft tissue will be adapting to the movements of your maxillary piece. And at the same time, on the right panel, on the upper right panel where the surgical movements are measured, you will notice the numbers will also be changing simultaneously based on your movement of the jaw. Also at the same time, if you move the jaw vertically, the vertical column will change, and on the lower border you will notice that the analysis colors are also changing at the same time. Similarly, on the mandible, if you click on one of the blue dots on the mandibular section, you will be able to do the BSSO type of surgery planning. And when you change the position of the corpus, in that sense, you will notice on the right side that BSSO numbers, horizontal and vertical numbers, will be changing in relation to the amount of movement you did. One other thing that you see, the arrows are appearing on the lower border of the mandible. If you click the arrow and move it, it will rotate the section or segment you will be doing the surgery on. On the lower right again, the analysis will adapt simultaneously to your movements, and the colors will change depending on the norm and the standard deviations of each case. So your new measurements will be appearing on the first column represented by the heading of measurements, and it will show you what will happen to the measurements when you change or make the necessary changes on your planning depending on the estimated means and standard deviations. Now, another feature is that you can also do genioplasty surgery by just clicking at the very lower anterior portion where the symphysis is, and similar to all the changes you did to maxillomandible, you can only move the symphysis section or move the genioplasty section as well. Similar function is true for genioplasty. With changing the arrow, you can rotate the segment after cutting it, and based on the final appearance, you can also take it back, that movement, or you can. Another feature is that you can do some auto-rotation by clicking at the purple region, which represents the whole mandible, and control it by the again appearing arrow key right in front of the symphysis region, and just to make sure that after you do impaction of the maxilla, you can close the whole mandible. Once more, all the movements will be recorded on the top right section. So if you like to do, you can always go to upper right menu and click and select export PDF in that menu, and the new window opening will ask you which analysis do you want to export the PDF with, and after that, when you click export PDF, a new PDF will be created, including your pictures of the patient, including your cephalometric tracing, and also the analysis results will be appearing there based on their surgical planning and surgical interpretation and the numbers associated with your movements will appear there. Now, when you go back to the STO function or the STO windows, what you can do, if let's say you have multiple plannings you want to discuss or you want to try, you can click on the upper right menu, duplicate STO function, and it will create a duplicate of the same STO and start for where you left off again, and you can do the changes based on where you left off. And in addition to moving the jaws, you can also put the numbers on the necessary segments or the cells on the upper right corner. It will make the movement according to the numbers you decided for your surgical planning. Now, there's another way of duplicating your STOs. You can go to the main menu for the patient and click the triple dots on the ceph and create STO there as well. It will automatically take you to the STO function, but this time it will start from the original position of your cephalmetric tracing again. So that's another way of generating STO, and you can do the same things you did previously, or you can totally plan a new surgical treatment objectives for your case. If you go back, you will notice now you have 3 different versions of your surgical treatment objective planning. Thank you for watching.